Hi everyone, thank you so much for joining us again. So my name is Florencia. So we have a summit, Your Child with Autism, how to connect and empower your child to create a life of peace, harmony, and freedom. Today we have an honor to meet Dr. Neil Margolis. So let me give you a quick bio of Dr. Neil. So Dr. Neil Margolis is an experienced development optometrist practicing in Arlington Heights, Illinois. He has specialized in his practice over the last 30 years towards the evaluation and treatment of vision processing skills as they affect academic learning and visual attention. In many cases, this includes assessing children who are nonverbal and inconsistent with their motor responses. He is on the advisory board of Soaring Eagle and Giant Step schools, which are dedicated to educating children on the autism spectrum. Dr. Margolis provides vision-related recommendations for the IEPs and for treatment plans. So let me, why don't you give your quick introduction? How do you get to the special needs, vision treatment?
Sorry, could you repeat that?
So how do you get it? So you do like a special need vision treatment, right?
Yes.
So how do you start first? Like, how do you get into this specialized?
The specialized area?
Mm-hmm.
Tell you why. My wife's actually a speech therapist, and she initially was working with children that had difficulty with communication, verbal communication. So she was designing augmentative communication devices, and she had difficulty differentiating whether their difficulty in responses was because of their ability to see or because of their visual processing or their visual motor activities. And so no one was helping her with this differential diagnosis. So I developed the skills to evaluate these children who often were nonverbal or didn't give consistent subjective responses so that we could better make recommendations for the displays on the augmentative communication systems. And then once other therapists realized that I could evaluate these kids without as much feedback and evaluate their skills objectively, I got a lot more referrals, and I got invited to evaluate kids and design therapy programs for some of the schools that were developed just for these children who were on the spectrum that weren't able to attend mainstream schools or weren't doing as well in mainstream schools.
Wow, that's very good, because sometimes they're not verbal. Like I have my kid and he doesn't even say anything, and suddenly I ask, what is that? He didn't even know that he need glasses. So this is like really helpful to have like assessment specialized for them.
Right. And I got one situation that always sticks in my mind is I had a young boy, he was about 10 years old, and he'd gone to a number of evaluations, and the concern that he always squinted his eyes or would close one eye, or his face was all scrunched up. And he was always being told, the parents were being told that he was doing this because he had an autistic symptom, a STIM type behavior is why he was doing it, like a stereotypical behavior.
Mm-hmm.
And when I evaluated the child, it turned out that he was actually seeing double vision because his eyes weren't straight. They weren't working together. So he was closing his eyes and squinting to avoid seeing double vision. And once we addressed that problem with the proper therapy and special prism glasses, his face opened up, his eyes opened up, his engagement, his concentration improved, and he could benefit more from his other therapies. So that kind of thing stuck with me. And then also, hopefully we'll talk some more about it, but I noticed that a lot of children were using their peripheral vision in an unusual way to attend. And I found therapies that were able to help these kids to attend and visually in a more appropriate way, which helped them with learning and even socially. So hopefully we'll talk a little bit more about that. Yeah.
So you do like a vision therapy for the kids, and you do, not only glasses, you do therapy itself. Can you tell more about it?
Sure. So vision therapy to me is using lenses, filters, what we call prism glasses or light therapies or specific activities. And
Mm,
the reason why is because some of the kids have lower aptitudes in developing some of these skills. So even though they're exposed through play and everyday experiences, these experiences aren't sufficient enough to advance their skills in a typical way. So what vision therapy does is it creates exaggerated, repeated learning opportunities, a little bit like extra lessons in these particular skills, so that they advance as a result of these repeated experiences. So my experience as a developmental specialist allows me to understand what, for example, a 4-year-old, what skills and concepts does a 4-year-old need to learn in terms of visual processing in order to advance and perform like a 5-year-old? And what does a
mm,
5-year-old need to learn in terms of visual skills to advance and perform like a 6-year-old? And my true passion is teaching concepts. It's one thing to teach a kid a splinter skill, just to do one activities or one puzzle. But when you teach them a concept, then they can generalize that concept to other activities, or they can grow with that skill. And that's very rewarding when you see the pleasure they take and their confidence grow as they realize what they can now do themselves as a result of what they've learned. So the true goal of vision therapy is to allow the growth of these vision skills and visual concepts through a combination of therapy activities and lenses, prisms, filters, light therapies, things like that.
okay. So do you have like a certain kind of requirement to get the vision therapy, like the age limitation or when?
Well, it depends on where you're doing it. For example, if you're doing therapy in a clinic,
Yep.
you have to have a space that can be either enclosed, or you have to be able to control the lighting, and you have to have enough equipment and activities to keep the child engaged and not have to walk away and get stuff.
I
But it requires a high energy level, also to keep the child's attention, and enough knowledge to help keep them regulated and engaged. If you don't have a child who can easily or appropriately sustain attention for a therapy session time, which would be most commonly like 40-45 minutes, then plan B is to teach the parent activities, or other therapists like that, maybe an ABA therapist who sees the child for many hours a week. So we teach them activities or skills to practice so they can work for just a few minutes at a time, which is maybe a better option for that kid and more realistic. And we provide the lenses or filters or prisms, or demonstrate the activities that the child should be practicing. And then when they've achieved those goals, they might come back, and then we'd recommend a next level of therapy activities. Everything that we work on is very hierarchical. Once you can achieve this, then we go to the next level, and so on.
Wow, that's very good. So you do like a parent training,
Yeah,
the therapist training, and then
exactly.
the
So
process.
sometimes other therapists will actually come observe what we're doing so they can help carry it over in another setting. Yeah.
Mhm. Is there a certain time of period, like how long is the therapy is?
It depends on the goals. And what I do is I do progress evaluations typically every 9 weeks. And during that 9 to 10 week time period, we expect to see some measurable, identifiable change as a result of what we've been working on. And that justifies the effectiveness of the therapy. And as long as we're seeing effective change in that timeline, we're happy to keep moving on. If we see that we've met our goals, or the curve starts to flatten, then we might recommend that the parent prioritizes another therapy at that time, or we'll put it we won't work on any new vision therapy goals that for a while. We might take a break and then work later when a child's advanced in other ways.
Mm. Wow, that is good. So like a typical, like sometimes the children with autism, they look at sideways and sometimes they do something. So that one can totally, gone after certain therapy.
Well, I want to talk about that because I think that's really, really important.
Mm-hmm.
We typically use our central vision for identification and recognition and learning. It's a higher level cortical pathway, your central vision. That's the
Yes.
type of vision that's usually tested when you go for a 20/20 glasses test. That's all central vision. Your peripheral vision is what you use to make you aware of what's going around in your background. It's kind of like what we call a vigilance system. It's very sensitive to movement and change. It's sensitive to lighting. It tells you
Okay.
where you are relative to things around you. So your peripheral vision is very much what we call a spatial system. Tells you where you are to your surroundings, makes you aware of movement. We call it your radar system. Now, what happens is that normally you should have a very good dynamic balance between central and peripheral vision.
Mm-hmm.
Central vision for identification, recognition, peripheral vision for awareness. So normally we use our spotlight of attention with our central vision to look at things specifically, and we maintain like a filtered awareness with our peripheral vision. Now, we see often that children on the autism spectrum, they'll use their peripheral vision in a dominant way, in an atypical way. You'll see them look at things with their head turned, or they'll run back and forth with their side vision, looking at edges, or they'll flicker their hands in their peripheral vision, or drop things in their peripheral vision, or
Mm-hmm.
light gaze, or look at fans, or move the door back and forth. So many things, we can go on and on. But they're basically using that peripheral vision, which is sensitive to motion and movement, to regulate their sensory pathways with that motion. And because that's what that pathway is designed to be sensitive to. So they restrict their vision to a sensory input, which they've got control over, and then they don't have to interact with other sensory input. So now they're attending to a
Okay.
sensory input that they've got control over, which is regulating them and they like. So they repeat that. It's a very comfortable place to be. But the problem is it's very non-productive for learning because their mind is basically pandering to the sensory system. Their attention is very restricted to one area just to manage that sensory regulation piece. So I see kids do this when they're anxious, when they're bored, when they're dysregulated, then they do that repeated patterns of behavior. And I see kids, they'll either be hypervigilant, in which case they're very distractible and they're distracted by any kind of movement. It's like they're noticing everything but nothing in particular.
Right.
Or if they're totally overwhelmed, then they'll shut down their peripheral vision and they'll tunnel their vision and they'll be engaged in something, and you can do anything you want next to them. They won't notice you. But those are the kids that are so tunnel vision that they seem clumsy or not to notice things, because even as they move around, they'll notice something. Like, I'll never forget this one kid who was very fixated on clocks. So he'd see a clock across the room and he would look at the clock and move through the room, bending forward on his tiptoes and not notice anything in his surroundings. He'd trip over everything else because he was so tunnel vision. So in my work, we recognize that to favor central vision, you create activities which encourage identification and recognition. Movement and balance brings out peripheral vision. Spotlighting is central vision. Using sensory movement lights or glasses that block out your central vision and favor peripheral vision, or filters, or special prism lenses that encourage peripheral vision. All of these become activities that the kids practice using with, to get them to practice using central and peripheral vision, and ultimately to create a better balance, which is very important for visual attention, especially in a classroom type setting. We have to attend to the teacher and ignore all the movement and visual clutter in your peripheral vision. So that ability to create a balance between central and peripheral vision is very, very important. And we see so many of our kids who have difficulty with that.
Wow, that's really powerful.
It
You can
is.
do like move like make it more balanced, right?
Correct, correct, yeah.
And how about like the reading and everything? So you just like combination everything, so they keep changing, regarding the age level,
Yes.
then
So
when they.
exactly. So what we do in an assessment, we look at all the visual skills that are necessary to use in the classroom for academic learning. For example, the ability to track with your eyes, to move from word to word, to practice reading. If you lose your place or skip words or misread words or omit words, then it's kind of like you're practicing the mistakes and you can't get the normal benefit from practicing reading. And certainly your comprehension is affected if you're misreading the words. And I'm assuming they may know the words in isolation, but they can't track them on the page to get the proper benefit from practicing reading. Now, visual processing is different from sight. Visual processing is kind of recognizing that you can enter a room and see everything, but you may not notice what's relevant to the actual task that you want to do. So
Uh-huh.
I always think of another word for visual processing should be visual noticing. Because you can, for example, driving a car, you might see the license plate in front of you, but you may not notice the kid running into the road.
Oh,
Well, in
okay.
the classroom, the child has to notice where's the next word that he has to track on the page, where's the next line, or he has to visually recognize the word, or he has to, if he's copying off the board, where's my spot as I go back and forth, or if he's writing, he has to notice how much space he needs to fit things in, or if he has this much space, how big can he make these words? Or even noticing which way his words should be to be the right way versus backwards. That's visual spatial processing. So all these visual processing skills are very necessary for learning. And unfortunately, in this time where we're doing so much virtual learning, it's even more dependent on visual processing skills to benefit from the visual demonstration, because there's so much less multisensory learning going on, which a lot of our kids benefit a lot from multisensory learning. Now it's hard for them to get it virtually.
What do you mean multiple sensory learning?
I mean, the ability to learn through touching, feeling, hearing, and seeing all at the same time, or to use manipulatives. So
Oh, I see.
you can practice, for example, some kids practice learning letters by using sticks, and they'll make an A with the stick, or practicing with things they can touch and feel, as opposed to just looking, where you can't, being forced to learn through one sensory pathway, which is vision, as opposed to multisensory learning with touch and feel and hearing and so on. And that's how kids learn in the beginning, is through matching all the sensory input, what they touch and feel and hear and see. And ultimately, they can look at things and know what they are going to feel like and smell like and taste like, because vision should become sophisticated enough to replace those other sensory inputs just through the right kinds of experiences.
Wow, that's true, huh? The life experience of, the thoughts, everything is really stick in our mind. It
Yeah.
helps
Yes.
the learning itself.
Yeah, it's vision is fascinating in the development of how it becomes so sophisticated. Take a very interesting example. I often call this little story how you get from Cheerios to Shakespeare, is when you show a little child a Cheerio for the first time, he doesn't know whether he likes it or not. He doesn't know anything about it. It's only after he tastes it and smells it and hears the crunch and feels the texture. So he's matching all of that sensory input. That's what I mean by multisensory learning. Now, the next time he looks at it, he knows if he likes it, because his vision has now replaced all of those multisensory matching experiences. He can just look at it and know all those things. Now, some kids need to have more multisensory learning to achieve that level of visual processing, so they can look at things and know things. Because ultimately, you want to look at a word and recognize from the letters what that represents, and know what all the qualities of that object are. So it moves all the way from, when kids put things in their mouths and when they're going around and touching everything and feeling things, and then they can look at it and just know everything they need to about those things by using their vision. So vision should become sophisticated. It's meant to be almost 80% of of learning is through vision, and vision is a primary sensory pathway because it ultimately guides movement and replaces a lot of other sensory input just to look at things.
Mm. Yeah, that's really good. So what is like so parent, if they want to do the vision, therapy, so what is like the symptom that they really, okay, this is time to do vision treatment? What kind of things that, in the category to be able to get the vision treatment?
That's a good question. Well, I find that a lot of times after I've lectured to occupational therapists or presented case histories, then kids who are using their peripheral vision in a fashion where they're not spending as much time engaging with direct eye contact on a screen or a page, but spending so much time losing their peripheral vision, that would be a reason to go get evaluated for vision therapy. Or kids that are not able to track on the page, or they can't learn their letters, or they can't match, or they're very poor at puzzles or sorting or stacking, or they appear to be very clumsy but yet their motor skills are okay. So kids who are not advancing in school academically and appear to be intellectually capable of doing that, or kids that aren't able to copy things or learn their letters or practice reading, or seem very clumsy, or using their peripheral vision, or if they have a lazy eye or an eye turn or poor depth perception. These are the kinds of things that I think are obvious signs. But a lot of the time, the kids are already working with occupational therapists, and they seem to be able to recognize quite well when the kids are not engaging vision to lead other skills like the motor skills or eye-hand coordination and so on, when they see it's causing difficulty. And when the teachers at school are noticing that the kids aren't advancing as they would expect, even though they might have 20/20 sight or they've gone for an eye exam, it would make sense to at least have their visual skills and their visual processing evaluated to see if that's a primary limiting factor or not, affecting the goals and performance. Yeah.
Wow, that's really detailing. Can you tell us more why it's kind of difficult for children with autism to look at the eye? Is it something that
Yeah.
is it something that really like a mystery that we need to know?
Yeah, I'm happy to share about that. When you are listening to somebody who's talking, it means that you're engaged in visual processing to look at
Ah,
their faces. And you're also looking at what we call nonverbal communication cues. For example, my mouth is moving, or my cheeks are smiling, or around my eyes or my forehead. There's all these nonverbal communication cues which add more meaning to what I'm saying. But it's very complex, it's very dynamic. And for some kids to take in all of this visual information at the same time as they're listening to the auditory input, it can be simultaneous processing overload. It's too much to look
I
and
see.
to listen. Like, you wouldn't be surprised if you asked me a hard question and I looked away up to the side till I got the answer. In other words, it's too hard for me to engage vision and to think at the same time because it's a hard problem. So these kids are disengaging vision so they can concentrate on the auditory input. And for these kids, assuming obviously you have to check that there's no a problem with eye teaming, which is making it strain to keep their eyes together. But more often it's this difficulty with simultaneous processing, and forcing them to look while they're listening is really not fair. In my opinion, it's not appropriate. It just will make them more anxious because it's like they're doing a trick instead of it having meaningful value. It's easier for them to actually attend to you when they separate the vision and the learning. And ideally, you should develop these pathways separately and then introduce them in a progressive manner slowly. as the kids can manage to do both at the same time. But forcing them to look before they're ready, I think is just going to make them uncomfortable. Yeah.
Wow, that's very surprising to know those things. I mean, like you need to learn everything about your face, facial, and then that's create a lot of sensory. I mean, like that is
Yes, but see, also the
interesting
kids
what you
don't
know.
necessarily recognize that for the speaker, when you return eye contact, it is telling the speaker that you're interested in what they're saying as a social cue. So that also, for if you don't know that, it doesn't have a lot of value. Um,
That's true.
so that's another reason why it's not as important for them to try do that. They'll rather listen to what you're saying. Yeah.
Yeah, I think I heard one of the autisms say either I talk to you or I look at you.
Yes, yes, yes. That
So
absolutely
I
makes
think they
sense.
only work one kind of
One
sense.
pathway at a time. Yeah, yeah. So it's like
Wow.
sequential processing or separate vision or separate auditory, but not together. Yeah.
Wow, that's very good. I don't know there's so much detail in the eye that you can do.
Yeah. Yeah. You know, most of my work is differentiating between sight and visual processing. Like I'm saying, one of my biggest concerns is that parents or teachers think that when a child has had an exam that shows that he doesn't need glasses and his eyes are healthy, that his vision has been checked. Yes, his sight has been checked and his central vision has been checked, but his visual processing has not been checked. And visual processing is what affects attention, what affects learning, what affects your ability to make judgments in your surroundings, like to judge with your vision when you can walk past the swing, to judge with your vision when you can cross a street, or to judge whether you can step down the stair or go between things, or it's your vision that tells you how to get to one room in the school to another independently to make these what we call visual spatial judgments. And it's your vision that helps you to track on the page, or to recognize letters or words, or to judge how much space you need to put your words in the page. That's all visual processing. It's not, people can see all these things, but they used to use visual processing skills to make these judgments, to notice what's relevant to the task. Examples are like when you have a busy page, you can see everything, but can you notice what you're looking for?
Oh,
Or,
that's true.
or when you're copying stuff, did you notice that, like a lot of kids, they'll copy and say, I'm done. And then you say, well, did you notice that that looks different? Oh, when you point it out, they do, but they don't notice these things themselves. So that's part of visual processing, is noticing things independently.
So not everybody, the optometrist, can do visual processing, right?
No, a lot of doctors do not. They just emphasize the sight and the glasses. So a way to have a better likelihood of getting this kind of assessment is there's a certifying body, or it's called the College of Vision Development, COVD. They've got a list of doctors who've become board certified in developmental vision, and they are more likely to do this kind of a work. Not all of them have a lot of experience necessarily with children on the autism spectrum. So you look at their website, or you call ahead to make sure that this doctor is experienced in doing this kind of work. But that's a way of making it most likely that you'll work with a doctor who will evaluate visual processing.
You say COBD?
COVD, College of Vision Development, yes. I've got these kinds of things also on my website. Yeah.
Okay. So if the audience want to contact you, what is the best way to contact you?
Well, my website is Visual Symptoms Treatment Center, and that will give you my email and our office phone number, which is a way to communicate with me. And I'll be able to, either myself or my colleague doctor, who's also does this work, will be able to answer your questions and or direct you to a doctor in your area who most likely can help you in this regard as well. But I appreciate the opportunity to share this information, because I think the more people that know this information, they become ambassadors, and they can help people when they recognize their kids are having this kind of difficulty, to help them understand that these kids can be evaluated. One of the saddest things for me is when a parent calls, and I have this a lot, you know, can you actually evaluate my child because he won't sit still, he's nonverbal, and he might run out the room, and all they're looking for is an understanding of what their child can see. For me, that's the least I can do, and I expect to do a lot more, but that's the least that I can do. And sometimes we send pictures of myself or what the office looks like or what we'll be doing so they can become more comfortable. Sometimes we have to go to the car to get them to more comfortable to see what I look like, or
Wow.
sometimes we'll let them in a different door so they don't have to go through another part of the office. There's things that I do when the kid comes in the room, like I'll sit on the floor sometimes so they're not, they get used to me and I'm not taller than them. These kinds of things help them to become more comfortable. We turn the lighting down, or the kids love some of the flicker spin toys, so we let them start out with things that they know that they like, they become more comfortable with. Or we tell parents to bring favorite toys or videos, and we use that stuff to engage their attention. So these are the things that we can use to make the kids more comfortable. And I can get a lot of information about what they can see and what visual skills are like without getting them to say or point at the answer.
Wow, that is very good. It's so hard to find doctor like you. I mean, like you all the way.
Well, as long as I've
You know,
got
it's
the
not like,
energy. Yeah.
I mean, like I have experienced my son always run away. You know,
Yeah.
doesn't he want to go in? It's like,
Yeah.
you know,
Yeah.
battle.
I've had those experiences and I've learned from them. Yeah.
Okay. So also you also want to give free gift for us. So can you tell me more?
Well, I do want people to understand if they have questions about their child or concerns that aren't being addressed by any of their practitioners or therapists that they have, they can call me, and I can try set up time to give them some answers. Either myself or the doctor that works with me, who's also knowledgeable in this area, one of us will try to get back to them and share information or give an answer specifically, and I will do that at no charge.
Wow, thank you
So
so much.
if that can be helpful, I will do that. Right.
Wow, thank you so much. It's really like generous of you to offer the consultation. I'm so glad that I have the opportunity to know more about the vision therapy. This is like, you know, really like writing and like something that people don't even think about, like something that in the eye that can go to the steaming and everything and can solve by just vision therapy. This is really powerful. And thank you so much for your time and your expertise and thank you so much.
Thank you. My pleasure. I enjoyed sharing this information, and I'm hoping that it helps people to make good decisions for their children as well. I
Oh,
appreciate this opportunity. Thank you very much for all the work that you do to help get this information shared with other people. Thank you.
okay. Thank you so much.
Goodbye.
Bye bye.